Hello everyone, today's topic is on peritoneum. So in today's topic we are going to understand about the peritoneum, its reflections, peritoneal sac and what are retroperitoneal organs. So peritoneum is the serous membrane which lines the viscera and the walls of abdominal cavity. So here is the sagittal section where we can see the vertical predisposition of peritoneum. So the sagittal section shows the reflections of peritoneum around the stomach, liver, and we can see the cut sections of small intestine, and we can also appreciate part of colon, that is the transverse colon, and here is the rectum, urinary bladder. So this is a male pelvis showing the peritoneal reflections. So the main function of the peritoneum is to protect and support the abdominal and pelvic organs. It also connects organs with each other. So it maintains the proper position of organs by ligaments. So it reduces the friction while the organs move. So let's see the layers of peritoneum. Peritoneum consists of two layers, parietal peritoneum and visceral peritoneum. So the outermost layer is the parietal peritoneum and the inner layer is the visceral peritoneum. So parietal one is the outer one which adheres to the anterior and posterior abdominal walls, means it lines the abdominal cavity and it covers the retroperitoneal organs on the ventral surface. So retroperitoneal organs, posteriorly we can see the abdominal aorta, and along with it the vein is the inferior vena cava, and so it covers the retroperitoneal organs like duodenum, so retro means behind and peritoneal organs means the organs which are behind the peritoneum, like you can see the duodenum, pancreas as well. So the parietal peritoneum is innervated by the phrenic nerve, lower intercostal nerves, subcostal nerves, iliopinguinal nerves and iliohypogastric nerves. Because parietal peritoneum developmentally it is along the body wall, so it is supplied by the somatic nerves. Visceral peritoneum covers the surface of intraperitoneal organs. So we can see the reflection of visceral peritoneum along the organs. So visceral peritoneum is along with the viscera and it is the inner layer which lines the abdominal organs, and it is made with the parietal peritoneum reflections from the abdominal wall to the viscera. So we can see here below the diaphragm with the peritoneal reflection, we can see where the parietal peritoneum reflects to form the visceral peritoneum. So similarly everywhere we can see the continuation of parietal peritoneum with the visceral peritoneum. So mesentery. Mesentery is a contiguous double layered fold of visceral peritoneum which suspends organs from the posterior abdominal wall and carries neurovascular bundles through the fat between the peritoneal layers to supply organs. So here is the mesentery. So this is the root of mesentery where we can see it covers the coils of small intestine, and we can see the blood vessels traversing through the mesentery. Not only the blood vessels, even the nerves too, to supply these coils of intestine. So from the anterior view, this is the mesentery where a part of mesentery, the layer of mesentery is removed to expose the contents. So the mesentery contains vessels, intestinal vessels, and it contains lymphatics. So the green colored structures are lymphatics. and it contains the nerves and anchors the bowel to the posterior abdominal wall. So it goes and anchors to the posterior abdominal wall. The mesentery of the small intestine is simply called as mesentery or mesentery proper. The mesentery of other organs are named according to the organ they are attached to. So here in this image we can appreciate the mesentery of the small intestine and mesentery of the colon as well. So this is the mesentery of small intestine, which is simply called as mesentery. So mesentery, which is called as mesentery proper, which is associated with the small intestine, whereas the mesocolon covers the large intestine, and transverse mesocolon and mesoappendix. So transverse mesocolon is this one, and this is the mesoappendix. So the mesentery of colon and appendix are termed as transverse colon, transverse mesocolon, or mesoappendix or mesocolon. Ascending, descending colon, rectum and the anal canal do not have mesentery as they are retroperitoneal. So ascending colon, then the descending colon, and descending colon continues as sigmoid colon, but sigmoid colon is peritoneal organ, but rectum and the anal canal do not have mesentery as they are retroperitoneal organs. Peritoneal ligaments are the mesenteric folds that connects the organs to each other or to the posterior abdominal wall are the peritoneal ligaments. Omentum. The omentum is the visceral peritoneum extending from the stomach and the proximal duodenum to the other abdominal organs. So we shall start with the greater omentum, which is along the greater curvature of the stomach. So greater omentum hangs like a curtain which covers the anterior surface of small intestine. So we can see it is like a curtain covering all the coils of the small intestine, and it extends from the greater curvature and covers the intestine. It contains gastrosplenic ligament which connects the stomach and the spleen, and this gastrosplenic ligament contains the short gastric arteries. Gastrophrenic ligament, it connects the stomach and the diaphragm, and gastrocolic ligament, it connects the stomach with the transverse colon and contains gastroepiploic artery. So that was about the greater omentum. We shall start next with the lesser omentum. Lesser omentum extends superiorly from the lesser curvature of the stomach and proximal part of the duodenum. So we can see the lesser curvature of the stomach and the proximal part of the duodenum provides attachment to lesser omentum. And from here, the lesser omentum connects to the liver. So you can see the liver here. Lesser omentum contains hepatogastric ligament. It connects the stomach to the liver and contains gastric arteries. Hepatoduodenal ligament contains common bile duct, portal vein and hepatic artery proper, which forms the portal triad. Next, regarding the peritoneal cavity, the space between the parietal and the visceral peritoneum. The potential space which you find between the parietal and visceral peritoneum, which is a thin layer, is called as peritoneal cavity. So this cavity is filled with a small amount of serous fluid secreted by the mesothelial cells lining the peritoneum. So the peritoneal cavity can be divided into greater sac and lesser sac. Greater sac, the main peritoneal cavity, which is the main peritoneal cavity, extends from the diaphragm to the floor of pelvis. So from the diaphragm above till the floor of pelvis, that is along the upper border of the urinary bladder and Douglas pouch or the rectovesical pouch. So till this dependent area it extends. So that is the extension of greater sac, and it envelops all the intraperitoneal organs. Next, regarding the lesser sac, which is otherwise called as omental bursa, which is an intraperitoneal recess that extends posterior to the stomach and lesser omentum. So I have to erase all this to make you all understand. So this is the stomach. So if you trace behind the stomach, this gap is the lesser sac, which forms the posterior relations of the stomach. So lesser sac is otherwise called as omental bursa. So let's see the boundaries of lesser sac. Anteriorly it is bounded by the lesser omentum. So here is the lesser omentum, which connects the stomach to the liver. And it is formed by gastrohepatic and hepatoduodenal ligaments, which are the parts of lesser omentum. And anteriorly it is also bounded by the posterior wall of the stomach. So this is the stomach, posterior wall of stomach. And it is bounded by 𝗑𝐼𝐻 ligament. So the ligament between the colon and the stomach is called as 𝗑𝐼𝐻 ligament. So posteriorly it is related to the pancreas, left adrenal gland and left kidney. So this is mid-sagittal section, so we cannot appreciate kidneys here. So it is also related to the left adrenal gland and left kidney. And inferiorly it is related to transverse mesocolon. So this is transverse colon, and this one is the transverse mesocolon. So inferiorly we can see it extends till the transverse mesocolon. So this is the anterior view of the lesser sac or omental bursa. So where the stomach is reflected to expose the omental bursa. So anteriorly we know it is formed by the stomach, which is lifted here, and it is formed by the transverse mesocolon, inferiorly by the transverse mesocolon. So here is the transverse mesocolon. Posteriorly we can see the pancreas, and also left laterally it is related to splenic hilum. Splenic hilum. On the right lateral side it communicates with the greater sac through epiploic foramen. So the opening here on the towards the right side is the epiploic foramen, which would be deeper. It is not demonstrated in this image. So the clinical significance of omental bursa, it provides entry into the omental bursa is required for pancreatic surgeries and to drain the lesser sac collections. It is the common site for free fluid collection in patients with intra-abdominal bleeding or acute pancreatitis. The complete peritoneal cavity, we know it is divided into greater sac and lesser sac. So the lesser sac is otherwise called as omental bursa, and it is found being posterior to the stomach and the liver, and it is anterior to the pancreas and duodenum. So the main functions of the lesser sac is to provide space for the free movement of stomach when it is full after intake of food. The shape of the lesser sac is irregular with one superior and one inferior recess. So it has got two recesses, one superior and inferior recess. Superior recess is bordered by the diaphragm and coronary ligaments of the liver, whereas the inferior recess is seen between the folding layers of greater omentum. So inferior recess, this section is taken along the inferior recess. So this is the greater omentum. So the communication between the lesser sac and greater sac is by a foramen called as epiploic foramen or foramen of Winslow. So the foramen of Winslow would be here in front of the inferior vena cava, where it communicates with the lesser sac or omental bursa, which lies posterior to the stomach. So let's see the boundaries of foramen of Winslow. Anteriorly, it is bounded by hepatoduodenal ligament. So here the hepatoduodenal ligament, which is a part of lesser omentum, it is removed here. So anteriorly, it is bounded by hepatoduodenal ligament, and posteriorly we can see the inferior vena cava. So this blue color structure is the inferior vena cava. And along with the inferior vena cava, posteriorly it is bounded by the right crus of diaphragm. So the crus of diaphragm is not demonstrated here. And superiorly it is related to the caudate lobe of liver. So here is the caudate lobe. And inferiorly it is related to the superior part of duodenum. So stomach continues into duodenum. Inferiorly it is related to the first part of duodenum. Greater sac. Greater sac, it extends from the diaphragm to the pelvic cavity. So we can see from the diaphragm above, so till the pelvic cavity. So it is divided into supracolic, infracolic compartments by transverse mesocolon. So here is the transverse colon. So the above to the transverse colon, it is considered as supracolic compartment, and below to the transverse mesocolon, it is infracolic compartment. So this is transverse mesocolon, which is the root of mesentery, which covers the transverse colon. Supracolic compartment is found anterior and superior to the transverse colon, and it contains liver, stomach and spleen. So we can see the liver here, stomach, and section is taken in the mid-sagittal section, and we know the spleen is present mostly on the left side, so you cannot see the spleen in this image. And infracolic compartment is posterior and inferior to the transverse mesocolon, and it contains coils of the small intestine, ascending colon and descending colon. Ascending and descending colon sections also can't be seen in this image as it is taken in the mid-sagittal section. Recesses of the peritoneal cavity. As the peritoneum wraps around the viscera, they form several fossae or spaces called as recesses within the peritoneal cavity. These recesses are common areas for internal herniation of abdominopelvic viscera. There are several such recesses within the peritoneal cavity of the abdomen and pelvis. However, more prominent within the abdominoperitoneal cavity. So here we are seeing some of the known recesses of the peritoneal cavity, which are named according to the structures or the viscera they are related. So the three main groups of recesses are duodenal recess, which are associated with the duodenum. So this is the duodenal recess. Cecal recess, which is related to the cecum and appendix, and intersigmoid recess, which is associated with the sigmoid colon. So let's see the clinical application of these recesses. So the recesses of peritoneal cavity serve to provide more space for viscera. So thus they reduce congestion of organs present in the abdominopelvic cavity. In the event of pus, fibrin or blood in the peritoneal cavity resulting from pathological or inflammatory processes. So the recesses of peritoneal cavity are the sites for catheter insertion to drain such abnormal fluids. Okay, organs of peritoneal cavity, intraperitoneal organs. So these are the organs which are covered by the visceral peritoneum and suspended by mesentery. So the organs which are intraperitoneal are stomach. So here we can see the stomach covered by the peritoneum. Then first part of duodenum, jejunum. We can see the coils of small intestine which contains the jejunum and ileum both, and cecum, appendix, transverse colon, sigmoid colon, and liver and gallbladder. spleen, pancreas, especially the tail of pancreas alone, bladder, that is the urinary bladder, which is also partially covered, and genital organs. So these are peritoneal organs, intraperitoneal organs. Retroperitoneal organs. Retroperitoneal organs are covered by the parietal peritoneum and they are not suspended by the mesentery. Retro means behind. So they are present posterior to the peritoneal cavity, and the organs which are retroperitoneal are duodenum, that is the second and third part of duodenum. So we can see partially duodenum here. Second and third part of duodenum, ascending descending colon. So here the transverse colon is reflected along with the transverse mesocolon to expose the posterior abdominal wall. So this is the transverse colon and this is the transverse mesocolon, and we can see the ascending colon here, which is retroperitoneal. Descending colon, which is also a retroperitoneal organ, and also the pancreas. The pancreas is not seen because it is within the concavity of the duodenum, but little part is still can be appreciated. So this is pancreas, head of pancreas. So head, neck and body of pancreas are retroperitoneal. The tail of pancreas is a peritoneal organ, that is, it is intraperitoneal part. Secondary retroperitoneal organs, organs which are suspended by mesentery during the embryonic period, and fusion of the visceral and parietal peritoneum fixes the organ to the posterior abdominal wall. So that is called as zygosis. So through the process of zygosis, the organs fixes to the posterior abdominal wall. So the secondary retroperitoneal organs are kidneys. So we can see little part of kidneys. Adrenal glands, that is the suprarenal glands which are above the kidneys. Ureters. Aorta, you can see the aorta. And along with the aorta, inferior vena cava. And also the lower part of the rectum and anal canal. So till the sigmoid canal, sigmoid canal is a peritoneal organ. So here this is the sigmoid. So sigmoid colon is an intraperitoneal organ. We can see it is covered by the peritoneum. And whereas the ascending, descending colons are retroperitoneal organs. So the secondary retroperitoneal organs, I will just repeat: kidneys, suprarenal glands, ureters, aorta, inferior vena cava, and lower rectum and anal canal. So these are the structures which form secondary retroperitoneal organs. Clinical application of anatomy of peritoneal cavity. So ascites. Ascites is the abnormal accumulation of fluid in the peritoneal cavity and common complication of diseases presenting with the portal hypertension. So example, liver cirrhosis, acute liver failure or hypobilirubinemia. Example, nephrotic syndrome. So all these are the reasons for causes of ascites. Other conditions resulting in ascites are like chronic heart failure, visceral inflammation like pancreatitis, or even malignant tumors. So here we can see collection of fluid in the abdomen, that is abnormal collection of fluid in the peritoneal cavity is called as ascites. So the clinical features include progressive abdominal distension. So you can see here a man having pendulous abdomen. We can see a distended abdomen and a shifting dullness and positive fluid wave test. And ascites may be associated with abdominal pain in rare cases. If one of the ascites is spontaneous or the origin is unclear, an abdominal paracentesis and ascitic fluid assessment may be performed. So that is to determine the appearance and composition of ascites. So the diagnosis of ascites is by physical examination and medical imaging like ultrasound. Management involves treating underlying condition in addition to sodium restriction and diuretic therapy, and severe or refractory ascites may require therapeutic abdominal paracentesis. A severe complication is spontaneous bacterial peritonitis. So, bacterial peritonitis. Peritonitis is the inflammation of peritoneum which is often caused by bacterial infection, and based on the etiology, peritonitis may be classified as primary or secondary. And primary peritonitis usually occurs in patients with underlying ascites, whereas the secondary peritonitis affects those with pre-existing acute abdominal disease. So, the patients typically presents with severe abdominal pain and guarding as well as nausea and vomiting. So, in most cases, peritonitis constitutes a surgical emergency. Diagnosis is established based on the clinical presentation, laboratory test, imaging and peritoneal fluid analysis. So, the treatment includes administration of antibiotics, surgical interventions as well. Peritonitis may be further complicated by ileus, sepsis or abdominal compartment syndrome. So, this completes the normal and clinical aspect of peritoneum and retroperitoneal organs. Thank you.